Hello, it's Dr. Bouvier with Michigan Paramedics, and we're here today to talk a little bit about sinusitis pearls. It seems to happen a lot when the weather changes, and so here in Michigan we get a lot of this issue. I've got a good friend and patient here, and she's had this issue, this sinus issue now for how long? 2 months?
Yes.
But historically, if you look back at her, she's actually had a voice change. You notice because you do things in the church and stuff, you notice this voice change, your production, getting the voice out there and projecting it over to the end of the hall. And she's noticed the voice change over the last 2 or 3 years.
Yes.
So she's had really a problem here for some time now. Chronic cough. You were a smoker for a while, right? Or not much? Has it been part of the deal?
I haven't smoked in 30 years.
Okay, and you quit. How long did you smoke when you did smoke?
I used to smoke a pack a week.
So it's really, smoking is really not part of her deal, but it is with other patients. So you kind of want to get this history. Another part of the history you want to get is, are they having any are they having any reflux issues going on? Because reflux is one of the most common things that can get up in the sinuses, cause a problem, and then that sinus throat problem can also worsen a COPD problem. So with you, it was primarily this pressure, drainage, tenderness over here, sore throat, and so these type of things were going on quite a bit with her. So we started with her to help. The initial treatment for most sinus issues, if there's not a high fever, is basically a neti pot, and I'd look that up, NEDI pot, look that up on YouTube. There's good explanations of how to use that. But how we used to do it before neti pot for the last 30 years is we take a bowl of salt water. It's usually an eighth of a teaspoon per normal saucer. I would use smart water if you're out there, because that's distilled water with little electrolytes. Add that Himalayan sea salt, room temperature or however temperature you like it, not hot, and then you would put your lips over and your mouth over the edge, submerge your nose, and actually snort. And not breathe in, so you suck it down your lungs, but you snort, and that just flushes everything out with a large volume of water. The little spray bottles we get, not enough volume of water. You need that volume of water to drain it out. So somebody comes back, like you're coming back today, the problem's still there. So she's got a little red throat, not bad, but you can see the drainage in the back of her throat. She's got tenderness over the sinuses still. She still has the voice changes. And so we're going to get a CAT scan of her sinuses. Regular x-ray is probably not good enough. If you're going to go get some sort of x-ray, just get a CAT scan of the sinuses. We used to order a coronal section of the sinuses. Nowadays with the new CAT scans, they can put that all together. But make sure you get it of all the sinuses, but also of the posterior fossa. That will include the mastoids, the inner and middle ear, and the eustachian tube, because those areas are potential areas that can have polyps and narrowing of the sinus drain holes, et cetera, et cetera. Of course, it'll pick up air fluid levels, but also pick up any polyp. So we're going to treat her with Bactrim. Actually, she's not allergic to sulfa, right? So that Bactrim should hit sinuses pretty well. I'm going to give her enough for 3 weeks with one refill, because usually antibiotics don't hit the sinuses very well. We'll find out if there's a drainage problem. Because of the voice changes, we're going to do a flexible laryngoscope. Actually take a look. Next time we see her, we're going to actually take a look at her vocal cords, make sure there's nothing going on there because of the voice changes for so long. And if she had reflux or a history of reflux, or when I do this flexible laryngoscope, there's certain characteristics that you can tell, and we'll do another video when we do that, on if the reflux is part of the problem. There's an entity called sinolaryngopharyngeal tracheal infection. And what that is just the sinuses draining and actually worsening a COPD issue. Many times chronic sinus is associated with COPD, and it can actually make that worse. So when you're working up COPD, you also have to look at the sinus issues. So that's how we're treating it. Some of the other alternative treatments, which many times we have to do, is get the chiropractors involved, because C2 many times is off. And if your sinus is chronic and it's just not getting taken care of, and they've got pressure, over the occiput or just lower to that with C2, you might want to consider talking to the chiropractor. We also use an herbal tea called Throat Coat, which will take away your sore throat almost immediately. And you don't have to worry about lidocaine or any of the other stuff. Throat Coat tea is very good for this sort of thing. If you have any other allergy history or smoking history, that also adds to the sinus issue. But here in Michigan, we seem to get a lot of it. So the take-home points here is get the X-ray with sinus. Initial treatment is not antibiotics. It's actually the neti pot or the sinus sniff that we talked about after they've had it for a month, or if they had a temperature even at onset, then we'd treat it. But usually hold off on the antibiotics because it just doesn't work very good. I've been friends with the ENT guys down at University of Michigan for years, and it's still one of the most difficult things to treat, and just causing problems, especially in the Midwestern areas like here in Michigan. So again, talking about sinusitis pearls. Again, give me some comments, send me an email, and let me know how you like these issues. Again, this is Dr. Robert Bouvier with Michigan Community Paramedics. Have a great day.